Good evening. Welcome to our Ethics and Society speaker series. Thank you so much for taking the time to join with us tonight. My name is Dr. Jim Hornstein. I am the chairperson of the Bioethics Committee at the Community Memorial Health System, and it is truly my absolute pleasure to moderate tonight's program entitled The Art of Advanced Care Planning, a virtual night at a gallery. Now, full disclosure, tonight, frankly, we are not actually at an art gallery. Realistically, none are really open right now because we're still living in a world with COVID. However, we are coming to you live, and we're delighted to be speaking to each and every one of you from the third floor of the Community Memorial Health System's Mountain Tower Media Studio. I should also say, please rest assured that all members of our panel tonight and all production staff have received COVID-19 vaccines, which, as far as advanced care planning, I hope you in your future planning also plan on getting. Very soon, I'll be joined by 4 incredibly special guests, and together we will celebrate National Healthcare Decisions Day. So, happy National Healthcare Decisions Day. I'm sorry, you don't know what National Healthcare Decisions Day is? Well, no problem. Let me tell you about National Healthcare Decisions Day. It is a day that's very special for all Americans because we get to celebrate our fundamental right to make and to record our very own personal healthcare choices. You may not even realize it, but this is, in fact, a very big deal. It's a big deal because this right not only affects each and every one of you, but also affects the people who you love and care about the most. And why I believe everyone who's important to you right now ought to be listening to this show at this very minute and be sitting directly next to you. And I do mean everyone. Not just people who have serious illnesses or people who are quite elderly. I mean everyone you care about. Why do I feel that way? Because COVID, like advanced care planning, we are all in this together. You may not be aware of this, but studies have shown that over 25% of the time, patients who are admitted into a hospital are either unable or incapable of speaking for themselves when serious decisions have to be made about their health. Over 1 in 4. The reasons for these are many, and you know some of them. Sometimes it's caused by the serious illness itself, sometimes by accidents, by drugs, alcohol, medicines, by shock or a stroke or whatever. You get the point. Sometimes patients come into a hospital and just can't speak for themselves. So the next question is, if you can't speak for yourself, who are you going to ask to speak on your behalf? And the answer is, you get to decide who will speak for you if you cannot speak for yourself. And that, in fact, is the very good news of National Healthcare Decisions Day. It is your individual choice. But here's the bad news. Most Americans, over 70%, have either not made that choice or haven't told anybody about it. But you might say, so what? What's the big deal if I don't make an advance directive and really think about my health problems in advance of really getting sick? By the way, that's why we call tonight's program Advanced Care Planning, because it is actually planning things about your health care in advance of, or frankly, before you really need them. And the best time to have these conversations is right now, on this beautiful spring night in April, and not when you're in an ambulance on your way to the hospital's emergency room. So here's my point. Making important decisions when you have the time to think about things and discuss it with your family and discuss it with your loved ones is very good. Making decisions in the heat of an emergency not so good. Anyways, I asked earlier a question. What's the big deal if I don't make these choices ahead of time, if I decide not to fill out anything now? Well, in some states, it's not as big a deal as it is in California. Why? Because in California, we have no defined order of who gets to make your decisions if you haven't told us. In other words, California has no defined hierarchy. And in many clinical situations, the fact that we don't know who you want to speak for yourself, but we have to make decisions, can cause preventable delays, confusion, and chaos for your families, for the people who you love, for your friends, but frankly, also for your healthcare workers. And this is as true if you're 18 years old or 88. And I mean this. If you're 18 years old and going off to college, and you're going in the fall, which hopefully is open, you ought to fill out an advance directive to legally and ethically allow your parents or whoever else you choose to speak for you if you can't speak for yourself. But getting back to tonight's theme of beginning conversations, what if you still don't feel the need to have these discussions about advance directives? After all, you might say, I've lived with my family for a very long time. Don't they already know what it is I want or I don't want? Sadly, the answer is no. Studies have shown that most of the time, family members have no idea what you want unless you actually tell them. Other studies show that even your personal doctor, your family doctor, or your specialist really don't know your personal choices, again, if you don't actually tell them. So it gets back to you and why it's important to you to begin these important conversations about your values, your goals, and your preferences. And to help me encourage you to begin these crucial conversations are four tremendous guests tonight who will share with us their own perspectives on how to communicate most effectively with the persons who you love and care about the most. But before I introduce tonight's guests, let me publicly thank our hosts for tonight's event, the Community Memorial Health System. And please give me a second. I'd like to give a special shout out to the doctors, to the nurses, to the staff, to the administrators, to the volunteers, and frankly, to the trustees, all of who have literally fought this miserable coronavirus with remarkable caring, compassion, and kindness. Thank you all to my professional colleagues. I'd also like to thank tonight's special sponsors, the SCAN Health Plan, especially my SCAN colleague, Melanie Ware, who I hope is listening tonight. I'd also like to thank the Population Health Committee at the Community Memorial Health System, especially my co-chair and my friend, Christine Supple. A special thanks to our great professional production team headed by Christopher Charles and the wonderful CMHS Marketing Department, especially Megan O'Neill and their new director, Brianna Callis. And finally, thank you to my beautiful and understanding wife, Dana, who is not only my best friend, but also, apropos of tonight, is my surrogate decision maker. So let's begin this virtual night of advanced care planning at an art gallery, and let me first introduce my first guest, Mr. Bobby Williams. Bobby was born in Tracy, California, but raised in Carthage, Missouri. In addition to being a professional artist, Bobby is also a professional chef and sommelier. He graduated from the prestigious Culinary Institute of America and worked in New York City at Thomas Keller's 3-star Michelin restaurant, Per Se. He recently moved with his wife, Sarah, to our Central Coast, and since the pandemic, has spent most of his professional time, luckily for us, painting. Bobby, welcome to our program. Tonight is a night about improving communication and connections, As you share with us your particular art, can you also tell us if you believe art can help people relate better to each other sometimes when words fail them?
Absolutely. I think an interesting painting is a great catalyst for conversation. And for me, art that invokes some sort of emotion or some sort of feeling, automatically I want to talk about it. And I also, thankfully, I get to create it as well. So, yes.
In your first series, your subject matter is most frequently about farm workers. Can I ask you why you chose this subject? And is there something about these very hardworking, essential workers which you're trying to convey to us?
Yes, I drew a great appreciation for the products, food and produce. After working in Michelin-starred restaurants in New York City, you literally know the name of every farm that every eggplant or your butter comes from. And then living in New York and the concrete jungle that it is, you don't get to really see a lot of farms until you move to the Central Coast where I'm at now. And that's the first thing that shocked me was just driving and seeing these people out there in swarms working these fields from bright in the early morning till late at night, and just understanding the hard work, seeing the hard work that goes into what we take for granted almost every day. And this series of painting farm workers is sort of an homage to their hard work and just my appreciation for that.
Thank you so much.
Yeah.
We look forward to seeing some of your other paintings in just a few minutes.
Thank you.
Our second speaker is a very special person to me and to Community Memorial Health Systems Institution, Mrs. Diana Jaquez. Diana was born and raised about 1,000 miles south of Ventura. She received both her bachelor's and master's degrees in nursing from San Diego State University. She is an exceptional palliative care nurse and has risen through the ranks to be director of the Community Memorial Health System's Palliative Care Service. She is married to her husband, Dan, and has 9 children and 2 dogs. She loves riding motorcycles, and my own theory about that is she uses them to escape her 9 children and 2 dogs. Diana, before you begin, I'd like to read a poem which I think captures a bit of what we're trying to get through tonight. It is called Otherwise. I slept in a bed in a room with paintings on the wall and planned another day. But one day I knew it would be otherwise. Diana, right now, tonight, we're in a room with paintings on the wall. I was hoping you could help us plan for all of us another day.
Thank you so much, Dr. Hornstein, for having me. I want to thank each and every one of you for joining us tonight for this very important topic. Advanced care planning is about having discussions regarding what you value and how you want to be treated both personally and medically. Advanced care planning is fairly new to medical decision making. Until recently, most medical decisions were made by physicians. That culture changed after many hard-fought battles for patient rights. In 1990, the Patient Self-Determination Act granted patients the right to make complex decisions for themselves regarding their own health care and to initiate advanced care directives, including proxies or alternative decision makers. Over the past year of this pandemic, I think this issue is even more important than ever. After nearly 600,000 COVID deaths in the United States has made us all take a deeper look at this need for advanced care planning, not just for those with life-limiting illnesses, but for all adults, like Dr. Hornstein said, over the age of 18. In the absence of a serious life-limiting illness, you may have never thought about having a discussion about your values with others. Or if there may be a chance that you've had a consideration of this, but took the form, set it aside, and decided that you would fill it out at a later date. There are many reasons for delaying these discussions. Some people have anxiety or fear over the unknown. They may be afraid of initiating a conversation with family. They may be feeling well at the time and just don't recognize the need for planning for the future. But most importantly, recognizing that we are all by nature avoiders. I have a couple of questions for you. Number one, how many of you, if you had a chance, would prefer to make decisions for yourself? Number two, if you were unable to make a decision for yourself, how many of you would be more comfortable knowing that you've discussed your values with someone that you could trust to speak for you? Advanced care directives allows us to share your values, your choices, and your instructions about your future health care. The kind of medical treatment you would want or don't want, how comfortable you want to be, how you want people to treat you, where you want to be, and who you want around you if you know that your time is limited. It helps to clarify who you want to help make decisions for you if you cannot make a decision for yourself. As Dr. Hornstein said, in California, there is no hierarchy for decision making. I think that many people have a misconception about this. They have been told, or they think that your spouse or your significant other has the first position for making decisions. Well, that's not true, unfortunately. The California Hospital Association and the California Consent Manual states that there is no hierarchy in decision making for any adult. This means that any family member can speak for you, even if you've not discussed your values or wishes with them. Completing an advanced healthcare directive gives you an opportunity to clearly review your values and goals. What a good day would look like. What matters to you most? It allows you to include religious, cultural, or spiritual issues that you would like addressed at your time of death. It also allows for family forgiveness and togetherness, which may include atonement, who you may wish to connect with, and knowing that a lot of times our non-nuclear families are spread all across the country. This is an important thing for you to be able to speak for yourself. But most importantly, it allows you to create a valid legal document to share those wishes. Let's talk a little bit about advanced healthcare directives and what they are not. They are not prescriptions. They are not plans of care. They are not a do not resuscitate order. People often fear that if they create an advanced directive that they give up control of making their own decisions. Well, unless you specify on that form, the authority only becomes valid if you cannot make a decision for yourself. An advanced directive is not and does not give the power to make financial decisions now or in the future. And one of the most important things is it does not require a lawyer to create. And I'll talk a little bit about that in just a moment. What an advanced directive is, it's a communication tool. It allows you to select a proxy that is most important for you to be able to talk about your wishes and goals and have that conversation. So it's not really about just completing the documents, it's about having the conversation that culminates in creation of a document. What happens if you don't select a proxy? As I reviewed before, California Hospital Association has no hierarchy, which can lead to intense family discord in a time of crisis. It's a tool for advocacy. It allows you to choose a person that you are confident will honor your goals and wishes, and that you trust will speak for you in all your decisions. This cannot be your doctor. A lot of people do add their doctor to their advanced care planning or the advanced care directive, but it cannot be your doctor. But I cannot emphasize how important it is to have that conversation with your doctor, and that gives them that instruction to document in their own records, and then they can potentially assist your family with difficult decisions if it comes to that. The only way that you can ensure that your goals and values are honored is to complete an advanced directive and have the crucial conversations with your designated decision maker and your doctor. Let's go forward and just see how easy it is to complete one of these. If you enter the hospital or any healthcare facility, you're going to be offered an opportunity to complete an advanced directive. This happens to be the one that we use here at Community Memorial Health System, and it's a common advanced care directive form, although there are multiple other forms available out there. Step 1, even though it says part 1 here, step 1 is to have the conversation. Once again, it's not about filling out the form, it's about having the conversation that allows you to put the form into action. Then you choose an agent who will speak for you if you're unable to speak for yourself. This next section, you may also choose an alternate, but you really do need to make sure that you have the same conversation with your alternate and that your alternate and your primary agree together on what your plan is. You have 3 options for completing this document. Number 1, you can complete it and have it witnessed by 2 people, one of which cannot be a family member, and that costs you nothing. Number 2, you can complete it and have it notarized for around $20. If you have a bank that does notary, sometimes they'll offer that up. A number of other places offer notary as a mobile that can come to your home. And number 3, you can have it done by an attorney as part of a living will that usually runs between $500 and $1,000. Next thing, what do you do with it once it's completed? You need to keep a copy with your important papers. You need to give a copy to your proxy and to your healthcare provider for ease of access if it's needed. And number 3, and I think this is important also, you need to update it with any significant life change or whenever you feel it's necessary. Speaking about completing advanced directives, I think it's my privilege to talk about how important this is and how important it is to all of our adult population. As Dr. Hornstein said earlier, in this time of COVID, a lot of things come up that are unforeseen, unintended. It was not a car accident. It was not something that you could have potentially seen out of maybe a high-risk activity. It's important that we all have this discussion ahead of time when it's in the comfort of our own home with the people that we care about, and then get that document out to communicate to the rest of your healthcare team. Thank you.
Thank you so much, Diana. That was an excellent overview. Our next very special guest is Mr. Ben Betts. Ben was born in Tampa, Florida, but actually raised in a small town in Maine. He graduated from Hampshire College and today is the artist in residence at the Santa Barbara Center for the Arts, Science, and Technology. Ben plays a ton of instruments, including an instrument that actually weighs a ton, the steel drums. Ben, welcome to our night at the gallery.
Thank you.
Ben, tonight's theme is all about people communicating seriously with each other. Sometimes, however, words fail us. As a musician, have you seen music help people open up and communicate more clearly, more honestly, more authentically with each other?
Yeah, I have. I've been fortunate to have interaction with a lot of people in the musical way and in an audience performer way, and it's not literally about the sounds or the words that I'm making. It's all about that third place that is unnamed, and it's where you go when you close your eyes. It's the place that we all go to when we hear a song that we know, and it's a different place for all of us, but it's the same place at the same time. And I've had the experience recently playing for a family member on their deathbed, and of all the times that we say I love you, all the times that we say anything really, it's the songs that we shared that we'll remember, and it took us somewhere else, you know? So yeah, it's my communication tool. I know it better than English, so.
Ben, if you wouldn't mind, would you mind sharing with us some of your music and tell us what you're going to be singing for us?
Sure, yeah, this is In My Life by the Beatles. It just seems fitting. It's a song about that place and sharing those memories with those very special people, and kind of preserves those times in some way. It's a time capsule. are places I remember all my life, though some have changed forever, not for better, yet some remain the same. These memories have their moments with lovers and friends I still can recall. You know I often stop and think about them. In my life, I love them all. And of all these friends and lovers, there is no one else compares with you. No, I often stop and think about you. In my life, I love you more. Though I know I'll never lose affection for people and things that went before, I know I'll never stop thinking about them. In my life, I love you more. In my life, I love you more. Thank you.
Thank you, Ben. Rounding out our program tonight is our fourth very special guest speaker, Dr. Colin Scabeta. Dr. Scabetta was born and raised in the Los Angeles area. He attended medical school at the world-renowned University of California, San Francisco School of Medicine, where he received his medical doctorate degree. He stayed on at UCSF to complete a residency in internal medicine and then went on to a fellowship in palliative medicine, where he also completed his studies. He is currently running the hugely important inpatient palliative care service at the Community Memorial Health System, where he and his dedicated team of other palliative care professionals help so many patients and help so many families during this very trying COVID-19 pandemic. He is married to his physician wife, Emily, and he has 2 children and 2 dogs. If he has another 7 children, I believe he's eligible to get himself his own motorcycle. Ladies and gentlemen, please virtually welcome my colleague and my dear friend, Dr. Colin Scabeta.
Thank you, Dr. Hornstein, for having me and for putting on this wonderful event. I can assure you we will not be having 7 more children, but if we do, I probably will be getting a motorcycle. So like Dr. Hornstein mentioned, my name is Colin Scabeta, and I am one of the 2 inpatient palliative care doctors here at Community Memorial Hospital. My day-to-day job is seeing patients who are hospitalized, usually with serious illness, and helping to make sure that we take the best possible care of them on their terms, based on what's important to them and based on the wishes that they have. Often my patients are able to speak for themselves, but very frequently they are not. And the dialogue that we're having tonight about advanced care planning and the putting those wishes into words, into writing, is often what I and my team rely on to know somebody, to know who they are when they can't speak for themselves. So why talk about advanced care planning? Perhaps it's self-evident at this point, but we believe in it very strongly. I would say as a society, particularly as a field, the field of medicine, I would say we have an awkward relationship with death, with the end of life period. It's often viewed as a failure of modern medicine, a failure of doctors' ability to cure or fix disease, or a failure of a patient's ability to get well. And unfortunately, that's a perspective that disregards the reality that all of us will die. It is one of the few things we are guaranteed in life. And and not to be glib, but it has a lifetime prevalence of 100%. And few illnesses, I think, we can say that about. As a doctor working in a hospital, I have been a part of the care of patients who have died. And I can tell you there's a difference between what I would consider a good death and a bad death. A good death being one that is on the patient's or family's own terms, in which the dignity of the patient and his or her wishes is respected, and we feel like we've done the best for them in an unwanted situation. As clinicians, as doctors and nurses and providers, I would say we have some influence over the care that our patients receive through serious illness and at the end of life. But we don't have complete control. And I think as patients and family members in the community, a lot of the control also lies with you and the conversations that you and your family have before you become our patients. So helping to prepare for the unexpected or perhaps the expected as serious illness progresses is essential in how we as doctors provide care to our patients. And so we're using this as an opportunity to empower you, all of you who are joining us tonight, to start that conversation with your family and with yourselves. We know from the medical literature that most people recognize that having conversations about medical preferences is important. In a 2013 survey, 90% of people who responded reported that they thought it was important that they speak with their loved ones about the care they would want to receive if they were very ill. And yet in that very same survey, only about a quarter, 27%, actually reported speaking with a loved one about their wishes. Similarly, 82% in that survey said they thought it was important to put those wishes into writing, to make it clear and to document what their wishes would be if they got very sick and couldn't speak for themselves. And yet only less than a quarter of those same respondents had actually done so, had actually put their wishes into writing in the form of an advance directive. So a big discrepancy between what people think they want or what they do want and what's actually being done. And I think many patients expect their doctors to initiate goals of care or treatment preference conversations. But as a field, we're not always very good at doing that. As a physician, I can say that, and as someone who works with other doctors and helping to promote these conversations, we're not always very good at that. And so it's important for all of us, all of you who are not medical professionals, but our loved ones, our daughters and mothers and sons and fathers, to recognize that these conversations really need to start within important relationships, within families. So advanced care planning is a term we've used a lot tonight. Just to briefly recap, I define it as really two parts: a conversation that takes place between a person and their loved one or their spokesperson, who the person who they would identify as their advocate, and then taking action on that. Not just having a conversation about what's important, their preferences, but putting that into writing in the form of an advance directive. And I think Diana mentioned sort of some of the nuts and bolts of advance directives, and they can be a little bit wonky, but I'm going to break it down for you and make it a little bit simpler, I hope. An advance directive is a document that contains two portions, the first of which allows you to name who you want to speak on your behalf in the event that you are unable to speak for yourself. One of the things we've learned painfully well this year is that sometimes people fall ill unexpectedly and find themselves in a situation with little notice that they can't talk their way out of, or that in which they can't speak for themselves. And I have been forced to speak to loved ones or family members who have never had these conversations when our patient or their loved one is intubated in the intensive care unit on a life support machine and unable to make their needs known. So the first part of an advance directive is designating who that person is for you. And the second part is putting kind of your thoughts and values and preferences about the treatment that you would or wouldn't want into writing. And I'll get into some of the tools that we have to make that process easier in a few moments. That portion is called the living will, where you get to make your preferences for treatment known. And they can be very general, or they can be incredibly specific. And that's really up to the person who's creating the document. I recently had a patient who went into great detail about the interventions that he would want if he were on a life support machine with respect to artificial nutrition and hydration, how long he would be willing to remain on a life support machine. He gave very explicit instructions to his family so that they wouldn't be forced to make these decisions in the dark. So much like we know that there's a discrepancy between what patients want to be having in terms of these conversations and what they actually are having with their doctors and families, we also know that by and large, having goals of care or advanced care planning conversations leads to better medical care overall. Enhanced goal concordant care is another way of saying we're better able to match treatment to patient preferences when we've had these conversations earlier. Patients report improved quality of life when they've had conversations with their families or their doctors about what their values and preferences are. I think an important point that I want to highlight is not just about patient care, but it's a gift to families. So in one study, patients who reported having conversations with their loved ones and then became sick and died, those loved ones actually reported lower rates of anxiety and depression, having had conversations earlier with their loved one. And I think that speaks to how, without having these conversations, often we put our families in very burdensome and stressful situations, and they're riddled with guilt if they haven't made what they think is the right decision. So putting your wishes, not just in writing, but having conversations, ensures that your family will be able to advocate for you on your terms. And I should say, when I say your family, I really mean whomever it is that you designate. It doesn't have to be family. It could be friends, neighbors, people that you trust, that you would want to speak on your behalf. So how do we have these conversations? Where do you get started? The first step, I think, is coming to an event like this and tuning in and listening to myself, Dr. Hornstein, Diana, tell you our thoughts. But there are plenty of resources out there on the internet that can help facilitate these conversations right now. You can go online. One of the resources that I love is called the Conversation Project, and the website is theconversationproject.org. It's a project of the Institute for Healthcare Improvement, and it's a very user-friendly tool that allows people to essentially navigate the process of choosing a healthcare proxy and starting a conversation using open-ended, sort of non-intimidating, non-medical questions that you ask each other, sort of facilitating a dialogue between you and whomever it is that you want to have this dialogue with. There's also great resources for people who are chosen to be the healthcare proxy. So what kind of questions should you be asking? The Conversation Project also includes tips and tools and resources if you ever find yourself advocating for a loved one in the hospital, how to approach the healthcare team, what kinds of questions you should be asking, or they may be asking of you, what your role is as a proxy. So really, it provides a lot of really helpful practical tools and tips as we start thinking about having these conversations ourselves. So when I discuss advanced care planning with my patients, I think there's a few key points that I make and I want to share with you tonight. These are repetitive or have been said, but I think they stand repeating again. The first is, the most important part is probably allowing you to designate a person to speak on your behalf. Like Diana mentioned, in California, there's not a designated hierarchy of next of kin or decision makers. And so as physicians, we're often in the position of trying to figure out who is best able to speak for this person. It may be a loved one, it may be a friend, and there can be a lot of conflict when these aren't clear. So having an advanced directive eliminates that conflict, or at least simplifies it, and allows us to know who we should speak to about the care for this patient. The second is that it actually gives people, a voice when they lose their voice. It gives them the opportunity to express themselves in advance of their illness so that we, myself as a doctor and the family that we're working with, know how we can best honor a patient who's faced with serious illness when they are not able to speak for themselves. And the third is that you don't need a lawyer. A lot of the tools, several of the tools I just mentioned, can help you complete an advance directive online, and you can have it signed by 2 witnesses who are not members of your family and not your doctor, or you can have it notarized, and it becomes a legally valid document just as if it was drawn up by a lawyer. Ultimately, advanced care planning is about what matters most to each of us. For me, that's my family. This is a photo of my wife and our 2 kids who are almost 7 and 3. And when we had our first kid, when we had Anna, we completed advance directives, not just to make sure that we got the care that we wanted if something unwanted and sudden happened to us, but so that our family, our kids or my spouse, knew what was important to me and what my values and preferences were. So thank you so much for listening, and I appreciate your time and attention, and thanks, Dr. Hornstein.
Thank you, Colin. Excellent conversation. I'm now back with Bobby Williams. Bobby, let's turn to your second series of art. I notice in your series, you're focusing more on the beautiful California coastline. I have a question for you. Number one, did you paint these California coast scenes near us here in Ventura or in the Ventura-Santa Barbara County area? And number two, do you see a connection that you are trying to make between the beauty of our unbelievably gorgeous coastline with tide pools and with waves and with the beautiful mountains and the Channel Islands? And do you also contrast that with the harshness of nature? Not just the beauty of nature with the coastline, but the harshness that we have all experienced over the last 14 months with illness and the continuing coronavirus pandemic. Do you see a connection between these two, the beauty and actually some of the harshness of nature?
You know, I think in a roundabout way, the harshness of nature that is COVID-19 and having to be social distance, having to be away from and not connected to the people you're used to seeing in big groups like a good old barbecue, has given me more time and given a lot of people more time to get out in nature and actually go on a hike with just yourself or your spouse and go to the beach more and kind of just be more appreciative of what we have around us. I live in the San Ynez Valley. It's beautiful. It's awe-inspiring. And these are scenes from just over the mountains from the San Ynez Valley in just south of Goleta, north of Santa Barbara area. So Santa Barbara coast. And something as simple as a piece of driftwood or a outcropping of volcanic or black rocks is something that's around us all, you know, whether it's on your walking your dog or whatever. And I think that having COVID-19, for me personally, isolate myself and isolate me within my group, my small group of people, I was able to appreciate nature in a sense that I never actually painted a nature scene before COVID-19. And now I'm pretty obsessed with it. So it's something that kind of naturally happened.
So is it possible for members of our audience, Mother's Day is coming up, May 19th, a plug for Mother's Day. Could they go to these areas north of Goleta and Santa Barbara and maybe have a picnic?
Absolutely.
Maybe a Tom Kelleher Michelin 3
that would be
Michelin star
tougher to
restaurant
come by.
would be good. Okay.
We'd have to go up to Napa. But for these scenes, for instance, are just what I would recommend is just all up and down the Santa Barbara coast. The state beaches are absolutely beautiful. This area was from just south of UC Santa Barbara's campus in Goleta, just south of the pier, about 3/4 of a mile. It's a beautiful walk. On low tide, you can see all kinds of beautiful sea glass and people fishing and people just being near the ocean. It's just starting to warm up nicely, so I recommend it.
Well, thank you so much, Bobby, and thank you for sharing that with us.
Thank you.
Ladies and gentlemen, our evening, unfortunately, is coming to a close. As is our custom in the Ethics in Society series, each of our speakers is given 2 minutes to make some important concluding remarks. So, Colin, let me start with you. Colin, it's your soapbox.
Thank you. Thank you again, Dr. Hornstein, for having me and for creating this beautiful night and event. I spoke to you earlier, and I speak to you now as a physician who has these conversations regularly with my patients, but also as a parent, as a father, and as a son, and as a spouse, and as someone who doesn't want to think about getting sick myself, but knows that it's in the best interest of my family and frankly of myself to do so, and have started to have these conversations not just with my family but with my parents as well. One of the things I like most about my job is the opportunity to talk with patients, often during particularly vulnerable moments in their lives, about what's most important to them, and helping to craft and create treatment plans that fit their values and fit their preferences, even if the situation that they find themselves in isn't what they would hope for or want, often serious illness. But it brings me closer to them. It makes me feel like I'm doing good for them. And I would argue that the same thing holds true for having these kinds of advanced care planning conversations within your own family. And so I encourage everybody listening tonight to feel empowered, to have these conversations, to ask questions that might feel uncomfortable at first, but will pay off in spades in the future. Thank you. My last comment will be, please get a COVID vaccine and do your part, both for our community and for our country. We will all thank you greatly. Thank you so much.
I thank you. I'm very honored to have been here tonight, and I echo what Dr. Scabetta said. And I hope that we've been helpful tonight in answering your questions about advanced care planning. Remember that tonight is just the beginning of the conversation about what's important to you. And I hope, like art and music and other things in our life, family, that it brings us all together. Thank you.
Thanks.
Thank you so much. Ladies and gentlemen, before Ben concludes our program, please join me in giving a well-deserved virtual thank you to our 4 wonderful guest speakers, our artist, Bobby Williams, our Director of Palliative Care at the Community Memorial Health System, Diana Jaquez, our palliative care physician extraordinaire, Colin Scabeta, and our musician, Ben Betts. Also, a special thank you for our hosts for the evening and for their support over the last 8 years for the Ethics in Society program, the Community Memorial Health System. Please join us again on Wednesday, June 9th, when I'm absolutely thrilled to interview the nationally renowned speaker, Dr. Corey Martin, who will speak with us about a topic which may seem odd to you. It's odd because we're going to be talking about the science of gratitude. It's hard to imagine picking a subject like gratitude after what we've all been through with the coronavirus vaccine. But I hope to convince you that being grateful, even with all the disruptions and all of the messes caused by COVID, is hugely important for your individual health and also the health of your family, your friends, and the community. Finally, before we say goodnight, on behalf of all of our crew here at the Community Memorial Health System, thank you so much for joining us. Please, as Colin said, don't forget to get your COVID vaccines as soon as possible. And now it's my great pleasure to introduce back to the podium Ben Betts, who will honor us by playing something that he likes to help bring us home.
Thank you.
Ben?
Here's a little song I wrote. You might want to sing it note for note. Don't worry. Be happy. In every life you find some trouble, yeah. When you worry, you make it double. Don't worry. Be happy. Do do da 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 da. La da 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 da. La ba da da da. Do 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 da. La da 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 da. La da 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 da. Ba da 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 da. Ain't got no place to lay your head. Somebody came and took your bed. Don't worry. Be happy. The landlord said your rent is late. You might have to litigate. Don't worry. Be happy. Don't worry, be happy now. La da 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 ba da ba da ba ba ba. La da 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 da. Da 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 da. Do 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 da da do da ba 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 do. Ra ba ba da ba 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 bum da 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 dum. Thank you. Have a great night, everybody.